Hi guys, welcome back to my channel. Thank you for tuning in today. In this video, I want to talk about things you should expect to do after you've been admitted into nursing school, but before you actually start your nursing classes. So if you're interested in that information, then keep on watching. Hi guys, welcome back to my channel. If you're returning, thank you for all the support. Thank you for coming back. And if you're new, welcome to the family. My name is Pearl. I post videos every week about nursing, medicine, faith, and lifestyle. In this video, I want to talk about things you should expect to do before you start nursing school. So welcome to the family. I hope that by the end of this video, you should find reasons to subscribe to my channel and help me grow my channel. So let's begin. First off, I want to congratulate all those who've been admitted into nursing school. I know it's been a struggle, it's been a long road, it has not been easy. So give yourself a pat on the back. You have done really well for yourself. I am proud of you, so be proud of yourself like I am proud of you. You did good on your prerequisites, you did good on your entrance exams, and you put up a good show for your interview, and all that has paid off, and you've been admitted. So be proud of yourself. So let's talk about things you should expect to do before starting school. And this is in no particular order. First off, you're going to be required to do a drug screen. Nursing programs or nursing schools don't want to pull out any nurses or nursing students who will be taking patients' medications to meet their addictions, or just any nurse that will be working under the influence of some type of drug, be it alcohol, opioids, or any kind of street drug. So that's the reason why they're doing this drug test, to make sure that you are going to be a good nurse or a good nursing student when you're on your clinical rotation. So, and also keep in mind that the machines that are reading these urine samples, because it's usually a urine sample, the machines they can't tell if the drug in your urine is a prescription or if you just got it off of the street. So if you're on some type of medication, make sure you have your prescription and you show that to your nursing school and to the lab that's running this. So when they eventually, or if they see this in your urine sample or blood or whatever you give, they know that you have a prescription for this drug, so you don't get in trouble. They'll also require you to do a fingerprinting or background check, again, just to make sure they know who is coming into their program, so they know that they're going to be putting out good nurses or good nursing students. So, unless you have something really serious in your background, you should be okay if you don't have something like a felony. So, keep that in mind, and also remember that the drug screen and the fingerprinting is going to be paid out of pocket. Unfortunately, the nursing schools do not pay for this, so be prepared to pay, plan ahead, and look around in your area for the cheapest option and go for it. Third, they're going to require you to do some type of physical exam. They want to make sure that you're physically fit to do whatever nursing tasks you're required to do when you're on the floors. Nursing is not just giving medications or speaking to patients and their families or taking calls. There is a lot of physical work required of nurses. You're going to have to be moving patients, moving tables and beds. So you have to be physically fit before you can go for their nursing program. So the doctor has to give an okay and say that you're good to go before they let you begin. So um, you can either go to your primary care doctor for this, or I think the mini clinic at CVS also does this. If you have any kind of lung problem or anything with your heart, anything with your joints, or just any medical condition, make sure you tell the medical practitioner who is doing your physical exams so they check on that before they give an okay for you to go into your nursing program. Fourth, they're going to want you to be up to date with your immunizations while you're on your clinicals and while when you eventually become a nurse. You're going to be exposed to different kind of diseases, hepatitis, flu, you name it. So they want you to be up to date with your immunizations to protect you when you're on the floor. So make sure you're up to date with your Tdap, which is tetanus, MMR, varicella, hepatitis B, and they'll give you a list of immunizations that you have to be up to date with. So, if you're not up to date when you're going to see your, when you're going for your physical exam, you can actually just do all of that in one visit. They're also going to require you to do a TB test to make sure you don't have any kind of active TB in your system because that's putting your peers and even your patients at risk of contracting TB from you. So you're going to get an injection under your skin and you'll be back in 3 days for it to be read. Most people that were born and grew up in the US will be negative, so they're usually fine. But if you're positive, being whether you're born in the US or an immigrant, you're going to be required to do a chest x ray just to rule out any kind of active TB that's going on in your system. For my immigrant nursing students, if remember that some of our countries required us to do the BCG vaccine or to get the BCG vaccine when we were kids. So tell whichever provider you go to that you got the BCG vaccine because if you got that, you're usually going to react to the TB skin test. But do not freak out, do not panic. It's just a cross reaction. So just let them know, and they're still going to require you to do the chest x-ray just to be on the safe side. But don't panic, you don't have any kind of active TB. Lastly, they're going to require you to have some kind of health insurance. Just in case you fall sick while you're in school, they know that you'll be covered. So you can either be under your parents' insurance or your spouse or your own personal insurance from your employer if you're still able to work during nursing school. And if you're like me who could not work during nursing school, you can always get Medicaid because it's for the low income bracket and I didn't have any kind of income. So of course I was low income bracket and I qualified for Medicaid. So if you're in that category, you can always get Medicaid. It's pretty cheap. I believe I only paid like $5 for every doctor's visit that I had, and they usually cover for any most of the medications or screenings that I had to do. So look, check out Medicaid if you don't have any kind of insurance. Most importantly, remember to start doing all of this as soon as possible. Do not wait till the end because, especially in these times with coronavirus, clinics may be shutting down or they may not open or they may only work on appointments. And if you're unable to get an appointment, then you're not going to be able to do all these things on time because the nursing schools usually have like a due date for all of this. So you don't want to wait until the last minute. Save yourself the stress and do them as soon as you get that letter in the mail or as soon as you're told that you need to get them. Get them done and send them back to your school. Save yourself all that stress. So that's all I had for today. Thank you guys for watching. Please don't forget to like and share this video. And if you have not subscribed, what are you waiting for? Please don't forget to subscribe. And until next time, bye bye.